mga Dockies! This is Doc Jean and welcome to Dental Life. Now, on this video, we will be discussing if evidence-based is really the way to do our treatment in our dental life or dental practice professionally. What is your opinion about evidence-based? Now, mga Dockies, hold your hands and try to support yourself because my opinion with this may be very different in your own opinion. Now, let's set a certain standard of what I am trying to say because, you know, mga Dockies, there are people or Dockies who might misunderstand it, and because they misunderstood it and they don't want another perception or another view on this matter because that's what they are promoting, and that is one of the reasons why there is politics and why we are failing to grow in the Philippines and in other challenging countries, the dental practice. And you can watch that video. What is the reason? It is because instead of trying to assess, and again, this is part of the 3 steps on how we can maximize and use the SMART, which I also discussed on another video that you can watch. Assess what is really the importance of evidence-based, and like any other thing, no matter how positive the word or negative the word is, the difference of why it becomes evil or wrong is the intent or the intention behind the action. You can see that as an example of another video I actually released about why manipulation is not that all bad in improving our dental life. Now, evidence-based is, of course, everybody will say you have to use evidence-based as a treatment for your patient. Do I agree with that or not? Of course I agree with that. Because, of course, evidence-based, these are treatment that already has a predictable result. And the result being it is going to be effective. Now, when do I say that I don't agree in this evidence-based thingy? Okay, now, first, we go back to the SMART formula that I have been discussing on my previous videos. And this is the skills, the mindset, the attitude, the resources that you have, and the talent. Now, when it comes to skill and talent, sometimes there are Dockies who are talented not just as a dentist, but as a scientist or somebody who can discover materials, techniques, treatments that will up the ante or provide a better technology or technique in doing treatments. Now, this is where I don't agree with evidence-based. The reason why there are so many Filipino Dockies or Dockies coming from challenging countries ended up not being able to become a leader or to discover or invent a treatment for our profession is because the leaders surrounding or the factors or the people, the resources that are in that environment are hindering us to be able to explore other than this evidence-based treatment. Now, sa totoo lang, mga Dockies, bago naging evidence-based ang mga treatment na ginagawa natin, they started with having no evidence at all. Diba? And majority of the like penicillin or antibiotic, or I just recently discovered that erythromycin is actually discovered or invented by a Filipino medical practitioner. And these are not happening anymore in our dental life, in our skills and talent that are God-given, because the leaders or the people surrounding us, instead of encouraging us to explore and to really have the freedom to have the opportunity. And again, I had created a video about the things that we do not have a choice. These are things that are given to us, but there is a way in order for us to be able to triumph on those obstacles. This is the chance that how I wish a lot of dokis, especially in our country, in the Philippines, will have the freedom to be able not just to follow what is out there, but to be able to explore their skills and talents and invent or discover something that can be globally accepted and become evidence-based. Yan, mga dokis, ang ibig kong sabihin why I disagree when people or leaders are so focused on just teaching the evidence base rather than challenging the minds of the dokis that there might be other options of treatment. And this option can be explored. I'm not saying that we use our patient as a testing ground, but in all honesty, mga dokis, majority of the medicines out there, including our vaccine, needs to be tested to humans. Now, what is good about dentistry is that it is not as complex and dangerous as medicine or medical field. We will be able to explore things through the materials that we use and be able to think of other ways other than the typical treatments that are continuously bombarded in our head as evidence-based, and those are the only things that you need to learn. And for that, I totally disagree. Of course, as I've said, just to be very, very clear, when you do treatments to your patient, use evidence-based treatment. However, in terms of education, in terms of the lectures that are being presented to the dokis, there must be lectures in terms of encouraging our dokis to think outside the box, to be able to intrigue our minds and explore possible treatments, possible techniques in order for us to even deliver a better treatment. And of course, once you are able to do that, this doki hopefully will have the opportunity and support or the resources, which is part of the smart, that he or she can develop it more and later on be used in our dental practice as an evidence-based treatment. So, yan ang dahilan, mga dokis, bakit may love and hate relationship ako when it comes to our environment using evidence-based to manipulate us to either sell their product, sell their courses, sell whatever they want to sell, and inhibits us or prevents us to explore other things and the possibility for the dokis, especially there are so many talented dokis in my country, in the Philippines, to be able to discover and invent new things. And that comes from education. And hopefully, through this video, it will influence some of our leaders to create an opportunity for the kind of skills and talent certain dentists have or certain doctors have in order to invent something. Because we are so bombarded that we are not good enough, that we just follow the leader para wala nang ingay, you can live your dental life peacefully and wala kang intriga, lahat kaibigan mo. Well, that is good. But in all honesty, you actually sold yourself short by not using your God-given talent that was given to you. Because precisely your mindset and attitude is either influenced in the wrong way or are not being used the proper way. Or you are just too afraid to fail, or too afraid to explore, or too afraid to check out if there is another way of dental life that probably will be even better than what you have right now. So, yan mga dokis ang problem ko kapag ginagamit ang evidence-based na term in order to manipulate us and just follow the leader and not allow us to grow and become leaders ourselves. Now, if you like this video, as I've said, please don't forget to support Dental Life and to support me, docjean. Give me a thumbs up, subscribe, and hit that notification bell so that every time I upload, you will be notified. And the most important thing, mga dokis, is sana mag-comment kayo below if what I am producing or what I am doing in dental life is something that is valuable to your growth as a dentist, especially Filipino dentists whom I am dedicating this channel to. But of course, mga dokis, kahit saan kayong part ng mundo, you are welcome to be part of dental life. Also, mga dokis, before I go, I would really like to encourage you to check out our marketing course at DMD Center under the tutelage of Roche Ruiz. And if you would watch the video about this in terms of how manipulation becomes something advantageous or beneficial to our practice and it's not all that bad, okay? And of course, if I do find that there is a greater need for a lot of dokis here in the Philippines or those coming from challenging countries, then I am developing the book that I wrote, and instead of publishing it, I will turn it into a program. And if you are interested on it, I will release soon, hopefully launch the part 1 and be able to give you a starting point, a good starting point on how to use your smart and in order to create, grow, and sustain your dental practice and have a good dental life. Always stay safe and be healthy. Bye!